Hello everyone, in this class we'll learn about examination of the cranial nerves 9, 10, 11 and 12. The ninth nerve is glossopharyngeal nerve. The motor component of the glossopharyngeal innervates the middle constrictor of the pharynx and stylopharyngeus muscle. The sensory component carries the taste and general sensation from the posterior one-third of the trunk, the general sensation from the upper part of the pharynx and soft palate as well. The requirement for the testing the taste sensation are as that of a seventh cranial nerve. That is, we are supposed to take all the taste sensation in the different containers and swap sticks. The procedure: perform all the tests for taste sensation as described for the facial nerve. Then we have to do the pharyngeal test or reflex, which is also called as gag reflex. The afferent and different limbs are glossopharyngeal and vagus nerve respectively here. Ask the subject to open the mouth wide, touch the one side of the back of the throat, that is the pharyngeal wall, with a swab stick. Normally there is a contraction of the pharynx, elevation of the palate and retraction of the tongue is observed. Then for the vagus nerve, the motor component, which includes the muscles of soft palate, pharynx and larynx, and the sensory component, which is part of the external auditory meatus and the pharynx, carry general sensation from here. Then the autonomic component, that is the parasympathetic fibers to the heart, lungs and GIT. The nerve is tested by eliciting the palatal and pharyngeal reflexes. The requirement for the pharyngeal and palatal reflexes: observe closely the quality before examining. Observe closely the quality of the speech. The nasal quality of speech may be due to the paralysis of palate, and hoarseness of the voice is usually due to the paralysis of the vocal cord. Then ask the subject to say ah and observe the movement of both uvula and the palate, and this is called as ah test. Normally both halves of the palate move equally and the uvula moves backward. The pharyngeal reflex is elicited as we have done it for the ninth cranial nerve. As the area of action of glossopharyngeal and vagus nerves overlap, isolated paralysis of any one nerve is quite rare. So this is the ah test, okay, where saying ah, there will be raising of the both the palatal folds. Okay, so here in the right sided failure, there is a failure to rise here and the tongue is deviated to the left side. Then accessory spinal nerve, that is the 11th nerve. This nerve supplies the sternocleidomastoid and trapezius muscles. So power of these muscles are to be tested. But sternocleidomastoid asks the subject to press the chin downwards against the resistance offered by you. In normal individuals, both sternocleidomastoids will stand out and can be inspected and palpated comparing both sides. Then ask the subject to turn the head to each side against the resistance of your hand. Observe the contraction of the sternocleidomastoid and note the force of movement against your hand. In unilateral paralysis, the chin is deviated to the affected side on pressing it downwards, and there is an impairment of rotation of the chin to the opposite side. For trapezius, stand behind the subject and ask the subject to shrug his shoulders against the downward resistance from your hand. In unilateral paralysis, there is a drooping of the arm. Then hypoglossal, that is the 12th cranial nerve. So this nerve supplies all the muscles of tongue and depresses of the hyoid bone. To test, first inspect the tongue and for the presence of any fasciculation, and ask the subject to protrude the tongue. Normally, the tongue moves forward in the midline. In unilateral paralysis, tongue deviates towards the paralyzed side. That is because of the action of normal genioglossus. If there is a right side failure there, the tongue is going to move towards the right side. Then it has to be reported for glossopharyngeal nerve and vagus nerve together, then spinal accessory and hypoglossal. For glossopharyngeal, pharyngeal reflex and palatal reflexes, this is for vagus as well. Then you have to the test for the taste sensation of the posterior one third of the tongue. Then for the motor function of the vagus. Then the cranial nerves, sternocleidomastoid, trapezius muscles to be tested. Then for the 12th nerve, where the position of the tongue should be tested, whether it is central or no, then should look for the movement of the tongue, where you will be assessing the power. So this is all about examination of the cranial nerves 9, 10 and 11, 12. Thank you.